fracture is. If the fracture is located somewhere here or it's just here, but it's more severe, sometimes we could go all the way to the top.
The doctors will tell you.
This is good. This is a good size. But normally I do measure to my thumb right here, base of my thumb to my elbow. So I do have to have folding space. That's a good size right there. As far as the thumb, this is also good because you want to cover from like right here to the top. Perfect. And then water, never hot.
Always cold.
Always cold. It takes longer to dry when it's warm. So yeah, just room temperature cold. Brought in. Handshake in. So this is the position that the patient must maintain at all times. Those bones are going to heal in the way that we position their hand. So if we go like this or we're not paying attention to the angle, guess what? They're going to heal crooked. You move one finger, you feel the movement all the way over here. So everything is connected. Every position is everything. So handshake in. So then you're gonna give me a handshake and just bring it in, maintain it right there. Be very gentle, always thumb in. There. We're gonna make a snip right here on the thumb. Make sure you don't cut your patient. One snip, the thumb will come out through there. And then you're gonna get your thumb piece. We're gonna snip the sides of it as far as your scissors go. From there, I'm gonna move up 1 inch on every single spiral from there until I get to the top. Just 1 inch. Just let the road do the work.
How about the tightness?
Not tight, snug. There's no pulling. Just let it roll. Let it roll. And you come back down. And then I'm gonna go back to the bottom. When it comes to the bottom part, I do like to cut it. You can rest your arm for now.
I got it.
Like 4-inch little. And I do like to place this over the knuckles because it's so easy to forget about them. So I just lay it over. And this web roll's nice because it literally just falls where you put it.
That's why I was telling her this is better stuff.
And then this is going to be the tricky part right here. And it's the hardest, and then pretty much that's your cast. I like to, once I do this part on the knuckles, I like to make a slit on my web roll and just let this kind of fall into place here. I don't over pack because I don't want it to be too bulky. But when the cast hits this portion here, a patient could become, like it can cut into the skin and it's so painful. So we have to make sure that that's very, very well padded. Just a snip and just let that go into that area. I think 3 should be good. And that's pretty much, and that same style is how we're gonna do the tape as well. So from here, I see that the doctors and everybody does it differently. They do the folding in the middle of it. I don't. I always do this
beforehand. You know, that's why I've always done it.
Especially when you're alone and you don't have assistance. It's really difficult to put the roll down
with the roll
or let the roll hang.
Makes sense.
So I like to just do this before. Maybe someone's gonna like tell me why it's done in the middle. I want to know why. I still haven't asked, but that's just how I do it. So long enough to where it covers, you know, the ends. And then here, we're gonna give access to the knuckles. This is crucial. the knuckles have to be out.
Mhm.
If they're not, the patient will not be able to move their fingers. That's where the stiffness begins. That's that. And then we start the tape. You have any questions? So you have to wear gloves because this is extremely tacky and it will stick to your fingers and it will not come off for days. If you try to remove it, it could be painful. Also, tell the patient to not touch the cast while it's still wet. They do become curious about what it feels like. It's sticky, but don't touch it. It's not the smartest thing to do. So, same thing. You're going to let your roll do the work. And you're going to pay really close attention to when you come down to the hand part. You want to leave space from where it ends to where you leave your tape and where the actual cast starts. Now, when it comes to the thumb part, this is going to be the difficult part. You make your wrap. Once you get here, your scissors will come this way. Just make one snip, another one. Just straight. There's nothing special about how you cut it. Just cut it straight. And bring it. The molding and making it flat and everything will come after, so don't worry about that. Again, another snip. The closer you cut it, the more it opens up. So if you guys see right here, it's not touching his hand, it's not touching anything. Little wrinkle there, it's fine. And then you use that to conceal the edges. You work your way back up. Work your way back up. Come back down. Again, not tight, just snug. And the patient will feel that it's getting warm just as it's drying up. How does it feel?
Feels good.
And the whole time you want to make sure that they're maintaining that position that you need, that handshake position. Soap to smooth out the edges. And this is your chance to just check and make sure that nothing's sticking out. But again, you do want to leave some space, half an inch, from where you finish your tape to where the cast actually starts. And that's your cast. That's your short arm cast.
Beautiful.
How does it feel?
She makes it look so
Move your
easy.
fingers. It's a full movement of the fingers and the thumb limited. Yes.
Now I see why you can't position like that. There, yeah.
I was like, you don't want to do that.
Why do you use the soap?
To take away the stickiness,
That's
and then sometimes,
smooth out the edges.
yeah,
so it
like
doesn't
this could
get-
lift. It just helps
I was
to
just
like.
showing her right here. Didn't mean to touch it. I wasn't meant to touch
No, I
it.
was telling you, like Gaby explained it. She's teaching
Yeah.
class.
So it helps flatten everything out. It's just to finalize it. It's like your seal, pretty much.
I've done that.
Yeah.
Way too much. I had to go dry it off. Oh, comments.
Yes. So if you guys want, we can try another one. We can cut it off. If you want to show Cindy how to cut it off, we're probably gonna let it dry like another 2 minutes. We can cut it off and then we can do another one the same.
Cool.
Sounds good.
Yeah.
Patients are always
And children, almost every single time every patient that you do this to, you definitely want to show them that it doesn't hurt. It'll save you them flailing a lot. When they think it's gonna hurt, they're gonna do this the whole time. And if you have your head really close to it and they do that, they're gonna hit you in the nose. It happened in my first couple weeks here.
But I've had them jerk away from them and relax.
I think it is a little bit nerve-wracking, even though.
And usually I don't start in this. And that gives me guidance one way or the other.
wherever the fracture is, so in this case, my fracture would be here. You want to be a little bit more careful, just, hey, like, because they are going to still be jolty about that. Just really guide it with your finger and go down slowly, right where the fracture is.
Right, yeah, well, I thought your fracture
Do you
was
always
here.
cut it like from
My
here
fracture's
to
there, you're right.
over here?
Your fracture's over here, and I know that, so that's where I'm going to. So can I have you turn your hand flat? Because his fracture is right here.
Uh-huh.
I'm going to go underneath a little bit further, and you're just at an angle.
Okay.
When I get close to this part, I always hold the hand here and then push it. I'm pushing the hand a little bit that way. Are you doing okay?
I always hold their hand there. That gives you just a little bit, if you can look from this side,
Yeah.
a little bit more away from it, and they're not so more nervous.
Their arms are going to get tired
A
from
little
holding it
tired.
up too, so you
Have
can
you
always
set
tell
it
them
down?
with your other arm, you can hold your arm up.
If they've been on a while, they're not that easy.
Yeah. This is really easy because it's not dirty, it's not sweaty, all those other things.
The only thing is I didn't go between his hand here. Most likely, we can cut up and not worry about that part.
When the
So
when
the
it,
thing only gets the like fiberglass,
Yeah.
but not
yeah,
the rest.
it
Yeah.
doesn't cut the rest.
Okay.
And it's nice to actually feel what it feels like to take it off too, because now I know it really doesn't hurt. I'm always nervous with Yeah, so what I was about to say is you want to be really careful with patient's skin
The thumb.
because this portion right here, even though it's not pointed,
No,
it catches the skin
it
and
jams into their skin.
it kind of folds over and it feels like they're cutting it. So like right
But they're
now
not.
it felt like it got cut, but I don't think it did.
They're
Just-
like
Yeah.
No,
so-
he wasn't kidding.
I wasn't kidding, that actually didn't feel good. So you always want to be careful. Remember, this is
That's
a
why I go
patient that's
backwards
scared.
on it.
In this case,
Now,
yeah, see, it was just she
slightly,
poked it pretty good.
I did poke it. Slightly move your hand up, slowly. There you go.
okay.
Another short one.
Let's do another short arm. It's the same thing that
So
she
she
just showed us. It's the same stuff. So go ahead and do that one more time. So think of it as from the knuckles all the way to, yeah, that's pretty good.
Okay.
Pretty good. It's better to have more.
Because you end up folding a little bit, right?
It's better to have
Fold
more
top,
rather than
fold
less.
bottom.
Nobody has sent it to.
We know they know you all too well.
Just the portion that goes all the way down, slowly down. You don't want to go too fast. Yep, just like that. You're going to pull that basically to where this is going to be just over the knuckles and the thumb. Do you have a thumb piece? You'll need a longer thumb piece than that. So this will grab it for you. So the next thing that,
The piece.
yeah, so the thumb piece is, you want it to be like that long. So for you, let me see that on you. So yeah, basically to that joint there. And then the next thing that was really important that she had done was, remember, she grabbed this piece right here,
And then made
pulled, and then made a little slit. But is this the 4-inch or the 3?
I think is it the bigger one?
The bigger one, we usually use it for like leg, versus 3.
Which one was that?
That's okay.
Was that the 3-inch?
matter.
This is the 4.
Oh.
Well,
did I grab that
usually
one?
for the arm, we use
Oh.
the middle one.
Yeah.
Yeah, don't worry about it in this case though. You're gonna grab it just right there. You're gonna get a good cut. You're gonna make it big enough so it's a little lower. No. Right where you had it. So grab it there, and then cut it a little bit so it's like the hole's a little bigger. Yeah, good.
It's from here to here.
And then pull it. Yep. The patient likely won't be able to move their thumb.
Sorry.
That was a quick meeting. So you don't need to do anything with that yet.
Okay.
Okay. And now for that thumb piece. So remember how
First
she
to
showed
cut
you
it first.
Snip it. Oh, like the sides.
on the
Yeah,
sides. Yeah. You got this, Cindy. A quick letter.
Does it need to cover all of it?
So the way I saw Gabby do it is she had this portion over here a little bit more,
Mhm.
so that when you pull this down, it covers more of the thumb.
Okay. But this is okay now?
What do you think, Gabby?
You want to cover the whole.
Okay.
So typically I do it.
Oh, she had it right the first time. My bad. Web drill. At least we grab her another drill. It might be so there.
Here.
So the only thing I could point out at this point is his position. He's like this.
Oh. So make it straight.
Right now it's not crucial because you haven't applied the tape,
Mhm.
but something you're gonna look at once you are.
Okay.
Oh, yeah.
Yeah.
You just enter it. It's kind of saggy.
It's either that or you guys could spiral it up and let it get bulky. I
Yeah.
prefer it that way. I think you could apply it exactly where you need it, so
Right.
it comes out cleaner and not too.
Messy where you don't need it.
Yeah.
Or do I have to
I like to place that directly here.
over the nose?
Even if you rip it up to, just mold it exactly how it needs to. And then your other set of 4 stacks is going to be for the thumb. And that part is the one that you can rip it before you cut it and start putting it there. And just repeat it. Just cut that one and then do the same thing like 3 times.
Usually cut it.
You can rip it, cut it.
If you apply pressure to the actual web room and you just kind of tilt the back at it, it'll rip a little bit cleaner. But you'll get there.
Give me pressure to it.
So the way that you have it, put it down.
Mhm.
Okay. Keep that side down, kind of roll down just a little bit.
Mhm.
And if you put with this hand, you put pressure, so you put your hand across it,
Mhm.
and then you just pull on that, it'll rip.
Oh.
You see what I'm saying?
Yeah.
Once you master it, it'll just be kind of clean. You'll get there.
It does take time with that fuzzy stuff. It's
Yeah.
full body cast.
Pull it so where it's flat as much as you can. That's good. So this part here, it's a little bulky. Yeah, a little bulky. I think here we could even cut a little bit more, so we can get it in there a lot. This, I think the sizing might have a little to do with it too, but it's okay. sizing of the stockinette. And then you want to fold this. And don't be afraid to pull and really conceal everything.
Mhm.
Yes, like that. Perfect. Maybe here.
Yep.
Maybe here I'm gonna cut just a bit,
Just so we don't have that.
just so it's not too bulky. Don't be afraid, guys. Do what you gotta do.
You keep saying top, I'm going to the other end. I'm like, oh, she means going. You're right.
Because the
My
wiffle,
backwards.
you can go up and down. Up
Yeah,
and down.
oh, I know.
A little bit.
It's kind of sticky.
Now for the cutting. Goodness sakes.
So the tape doesn't have to be as packed as the
I meant to cut it just to the edge so you can pull it over the thumb.
Oh.
It's okay, continue. So just wrap it around at least one more time.
And you do this like 2 times or just once?
Yeah, go ahead and do it 2 times. Go ahead and do another wrap. And make your snip right over here. Pull a little more. Right there. Yep. Yep. All the way, all the way, all the way until you get perfect. And just really lay that flat right around the thumb, not touching the skin. And then conceal it. You're gonna cover these edges, make one wrap, and then work your way up and you're done. Oh, jeez.
Just work with it, you got it.
Go up here again?
Yeah, go back up. Well, if it were white, we can honestly cut it and finish it right there because you already got the rest of the hand
But
for
if you get,
cosmetic purposes.
yeah.
You can cut it right there because it's probably not going to stick. That way, the soap can actually work. You can do your soap and we'll smooth it out. Just smooth everything out. Just rub it all over.
Yeah, so with the soap, you want to do this in your hands first and then put it on. Yeah, like that, so that spreads more. There.
So this part is that.
For it,
Besides my own work.
trust me, I do the same thing.
Yeah, especially the hidden areas. You know?
Yeah.
You flip it.
Yeah.
So cute.
I know.
So
Could have
pretty.
been this year, Mom.
Oh my gosh. Ridiculous. Oh, Cindy's first cast.
I'm gonna take a picture of it too.
Let me see the